Research reveals that nearly 1 in 10 men experience depression or anxiety, but less than half will receive treatment. Fortunately, the percentage of men getting treatment or counseling has increased over the past couple of decades, but there's still a stigma often attached that keeps them from seeking help. Memphis native Dr. Justin Dodson is a professional therapist and is here this morning to talk about why it's so important that he opened up your first counseling for men, adult men,
Yes.
adult men.
Adult men, yeah. That's
Okay.
the specialty, adult men.
Explain this.
Yeah, so when we look at the research, 90% of doctors' visits are due to stress and depressive related symptoms, but less than 12% of men are actually going to therapy. So when we look at the research, no matter if it comes from the CDC or the National Institute on Mental Health, it says that there's a need, and so we're looking to fill that by focusing on adult men's mental health.
Okay, so what is it that men you're seeing are suffering from mental illness and then not getting the help traditionally?
Yeah, so it's really on a range and a spectrum of things. So either you're dealing with poor mental health or you have a mental illness that is diagnosable. But what we notice is that oftentimes men really just need a place to feel safe, seen, and challenged. And that's where my practice comes in, to fill that gap and recognize the need of giving men a space to heal.
Okay, and you say that there are differing symptoms between men and women and
Yeah, so oftentimes men have this internal narrative that you have to be hard, you have to be a man's man, which really is aligning with someone else's version of masculinity for them. So you find a lot of men that isolate, that are hard, that don't know how to practice vulnerability because they want to live up to the expectations of other people, whether it's a wife or a partner or their friends or their community, and that really leaves them vulnerable and isolated and not willing to share and collaborate with a therapist to get the help they need.
So what kinds of concerns do you address?
I focus on addiction. So we see a lot of porn addiction, sex addiction. We see alcoholism, isolation, anxiety, depression, a lot of identity issues, grief, transitioning. You know, loss isn't just always in the form of a person. It's also in the form of a job or a career that you really wanted to be into, and then you lose it, and then you don't really know where your place is in life. And so we focus on a lot of those issues because they give men the space to really be who they are when we just sit down on the couch, kick our shoes off, and just get into it.
And you say that mental health can impact relationships.
Absolutely. If you get into a relationship and you don't know what you're doing, and then it comes up as an unhealthy relationship, or if you get into a relationship and you don't know how to effectively communicate or meet the needs of your partner, then you're going to actually probably have some difficulties. And so the same symptoms that we see in depression and anxiety, they will come out and manifest themselves in relationships. And we like to tackle those head on so men can develop healthy relationships with their partners.
And how does this work out in your practice? People call, is it a group thing or is it one-on-one?
Yeah, so mostly individual therapy. People can visit our website and then just fill out the contact information, or they can book now. We have 4 mental health professionals on our team, and so people can read their bios and book a free 15-minute call to get connected, and then from there, someone from our office will call them and get the ball rolling.
All right, and so that number is kind of like a regular day-to-day number, but there's also a national, there are some national hotlines and local hotlines that people can call. Why is that important to have that on hand?
It's really important because you never know where people are in their spectrum of need. So for our practice, it's private practice, but sometimes people need more serious help in the moment. And so having a number where you have a non-judgmental person on the other line to support you is really important.
All right, Dr. Justin Dodson, thank you so much for your work and joining us this morning to tell us what you're doing.
Thank you.
All right, still ahead this morning.